So what does the immunisation branch at the Department of Health and Ageing have to do with the immunisation program? So we do a lot of the work in the background that enables you to have vaccines in your refrigerators when a eligible person comes into the practice. So our role is around planning new vaccination programs. So when a vaccine is recommended by the Pharmaceutical Benefits Advisory Committee, that the government should consider funding it. Our role is putting together what the cost for that will be and how the program will be implemented. We buy the vaccines from the vaccine manufacturers, so that involves tendering and contracting. We implement new programs in partnership with lots of key stakeholders, including the states and territories, including groups such as APNA, and Karen Booth represents APNA on our National Immunisation Committee. We monitor the program, so we work closely with the Medicare Australia on the Australian Childhood Immunisation Register. We also have a register for HPV for both boys now and girls. And we do work such as working with our technical advisory group on the publishing of the Australian Immunisation Handbook. Right, so as I said, I'm not going to be talking specifically about guidelines, but the program itself is governed by a large range of policy documents and guidelines, so I'm going to touch on these as I go through. So I'm going to talk a little bit about the program, how new vaccines get added to the program, and about our schedule. We've got a number of program changes that have happened and are happening this year, so I'm going to mention those. And I'm going to talk a little bit about some of the guidelines that we have to guide the National Immunisation Program. So first of all, a little bit about the program, and some of this will not be new to you, but the program provides essential vaccines free to eligible cohorts, and the cohorts may be either age-based or risk-based. It's a joint program. It's delivered by the Commonwealth, funded by the Commonwealth. We spend about $400 million a year on vaccines in this country, which is funded by the Australian government, and we work closely with states and territories to ensure that vaccines are delivered into fridges in general practice so that they're available for people presenting. We have 16 vaccine-preventable diseases for which we provide vaccines, and we've got many new combination vaccines which you will have seen over the years. And these obviously assist with vaccine uptake, particularly for children. By international standards, we have very high immunisation coverage, certainly in children, less so in adolescents and in adults, but we've also had a significant reduction in vaccine-preventable diseases. So this graph shows the proportion of children in the Australian Childhood Immunisation Register that are fully covered for vaccines on the schedule. And you can see for the three cohorts there, the blue is 1 year, the red is 2 year, and the green is 5 year. You can see that we're well and truly at 90% on national average across Australia. The coverage for Indigenous children I don't have listed there, but is below the coverage for the national coverage rates. Indigenous coverage is at 86% for 1-year-olds, 92% for 2-year-olds, which is very close to the 93% for 2-year-olds, and 89% for 5-year-olds. So still some work to do there, but very good achievement. Recently, the National Health Performance Authority released its report, Healthy Communities Immunisation Rates for Children 2011 to 12. And it's really the first publicly available report on immunisation coverage at quite a low level. And this report shows immunisation coverage at Medicare local level and also at geographical areas called Statistical Area 3. The report can be accessed from the National Health Performance Authority website, which is listed on the slide there. The other very useful piece of work that was produced with this report is that on the National Health Performance Authority website you can also look up immunisation coverage data by postcode. So if you're interested in what's happening in your particular practice and in around your practice, that's a very useful tool. So we've been very successful in reducing vaccine-preventable diseases as a result of our high coverage rates, and this chart just illustrates some of those examples. So, yep. So, I mean to do that. Right. So this one here is pneumococcal, and it was implemented in 2005, and you can see this fairly significant reduction in pneumococcal disease as a result of that. These three are measles, mumps and rubella, and in 1998 the measles control campaign was implemented, and you can see we've got very low rates of that now. And in 2003 meningococcal C vaccination was introduced, and we've had a fairly significant reduction. We still have meningococcal disease as a result of other types, but certainly overall meningococcal disease has been reduced. So new vaccines get added to the National Immunisation Program. We've had quite a few that have been added recently. What's the process for that happening? So once a vaccine's registered by the Therapeutic Goods Administration, the vaccine sponsor can make an application to the Pharmaceutical Benefits Advisory Committee to list that vaccine. And that's the committee that also assesses whether drugs go on, recommends to the government whether or not drugs should go on to the PBS. If the PBAC provides a recommendation, it then goes to the government for consideration. And this is the National Immunisation Program schedule as it currently stands. I'm assuming most of you are familiar with it. The orange one is the new version that will start from 1 July 2013 this year. The handbook, which is currently being distributed, also has a blue schedule, which is the schedule up until 30th of June 2013. So a couple of changes we've got in the program coming up. On 1 July 2013, we're implementing measles, mumps, rubella, varicella vaccine. It will replace the 18-month dose of varicella and the 4-year-old dose of measles, mumps, rubella, so that's the second dose. So children at 18 months will be given this new combination vaccine. At the same time, the definition for fully immunised for the eligibility for family tax benefit will change to add varicella. Varicella uptake's probably the lowest uptake we have of all vaccines, so we're hoping that the addition of the combination vaccine will improve that. We recently implemented HPV vaccine for males in a school-based program, and this is to complement the vaccine program in girls. There's a 2-year catch-up program for boys 14 to 15. The uptake has been very good. We've been very pleased with how it's gone. And although it's mainly delivered in schools, there is some GP-based delivery depending on, and the arrangements depend on the state and territory. But if there's children who are aged 14 to 15 who aren't actually in the school year which is being vaccinated in that state or territory, they are eligible to get it from their GP. One of the guidelines we are working on and is almost completed is the National Cold Chain Guidelines. So the Australian Vaccine Storage Guidelines strive for 5, the second edition, and these provide information and advice for vaccine storage, and I understand are used very extensively in general practice, so I'm assured that people are looking forward to the new guidelines, and so we're hoping that will be out fairly soon. Other work we're doing is on provider guidelines, national guidelines for immunisation education for registered nurses and midwives. These are really aiming at having a national minimum core competency standards for immunisation providers across the country. And the new guidelines will have an increased focus on reporting of adverse events, cold chain practice, catch-up schedules and consent, amongst others. One further publication we're finalising is a publication called Myths and Realities, which is really for health professionals to assist in them responding to parents' concerns about vaccine safety. And we fund a range of communication activities which we make available on our website or send directly to practices, and these are some examples. And I'd just like to say, finish by acknowledging the role of nurses in immunisation. Obviously for us at the Department of Health and Ageing, we don't do much vaccination at the department, but we rely on people such as APNA, members of APNA, to do that. Thank you very much.